I would like to introduce Dr. Emma Lawrance, Jess Newberry, and Dr. Omnia from the Climate Cares team at Imperial College London, who will be providing us with an overview of the Connecting Climate Minds project. Over to you, team.
Many thanks, Jennifer, David, and Pablo. We are now going to introduce more of this project, what we hope to achieve, and the details of how you can get involved. We have heard emergency rooms filling with unexpected numbers of people in mental health crisis as the thermometer pushed past 40 degrees Celsius last year in London. We've heard that a teenager in the Caribbean feared the next hurricane, now coming harder and more frequently, will once again have his lifeline to antipsychotic medications and mental health support cut. We've heard of farmers in India facing yet another failed crop due to a climate-related drought, and the despair bringing them to contemplate suicide. These are just some of the stories our team have heard, as the burden of climate change on people's lives and livelihoods mount, eroding their mental health. Many in our team have experienced these burdens firsthand, and many of us have made it our mission to support those who experience it firsthand. And many of you in the audience will have your own such stories that we want to learn from this year. As these experiences increasingly affect communities around the world, it is becoming recognized that the climate crisis is deeply intertwined with mental health. Climate change is a risk multiplier, destabilizing the conditions we need for good mental health by increasing temperatures and increasing the frequency and severity of extreme weather and climate events. And these flow-on impacts disrupting lives, livelihoods, and access to healthcare, and sometimes people's hope for the future. There is already evidence that the hazards of climate change risk increasing deaths by suicide, worsening experiences of mental health challenges, and people living with mental health conditions can be more susceptible even to the physical health effects of climate change, such as the toll of higher temperatures. Burdens are uneven and deeply unjust, with people in poorer communities and those with previous experiences of mental health challenges more at risk. But climate action is also an opportunity multiplier. We have an opportunity to come together and ensure that climate action not only depends on, but can support the conditions for good mental health. As these impacts are increasingly felt, the climate and mental health field has been rapidly growing over the last years, and many of you I know on the call are already working in this space. We've seen in research that research explicitly working at the climate and mental health nexus is rapidly expanding. A 2021 review of the literature found that there was only 120 papers explicitly focused on climate and mental health in the time to that date, with the first only published in 2007. We conducted a search strategy, a search of 2022 literature using the same search and found 358 papers, nearly triple the literature to date just in the last year alone. In policy and practice, we've also seen this increasing need recognized. World Health Organization published their briefing paper on climate and mental health last year. And we've seen that the last two conferences of the parties on climate change, the biggest climate conference in the world, COP26 and COP27, featuring mental health conversations for the first time. We've also seen the 2022 reports of the Intergovernmental Panel on Climate Change, the IPCC, highlighting the evidence for how mental health is at risk and being affected by climate change, but also how climate action relies upon building the resilience of people and communities and giving them opportunities to participate, and that those opportunities can strengthen mental health. So with all this evidence and rising awareness, what's wrong or what's holding back this further unleashing of progress to meet what we know are mounting needs? There are still significant gaps in understanding the true costs of climate change on mental health and the true benefits and opportunities to act together for our climate and our minds. It is critical that the growing climate and mental health community are aligned, that we can connect and come together in an agenda for research and action, but we're currently still experiencing profound disconnection across geographies, disciplines, and sectors. In disconnection, An example is that we know there are great interventions. People are working already, many of you listening in, on interventions working with communities. But a scoping review of the literature last year found only a handful have made it into academic spaces, and we're not learning across the world from what's happening in other places. This means that there's unevenness and some duplication of efforts. For example, despite the burden falling in the majority of cases on low and middle income countries, the research is being conducted in high income settings. 77% of the literature in the 2021 review was conducted in high income contexts. There's also silos, so decisions being made on climate and on mental health happening in different disconnected and siloed spaces. And this is missing the opportunities for win-win approaches to both climate action and mental health support that benefit each other. So there is a strong need for connection and understanding how we can even the playing field, even the topics that we're focusing on, and ensure that we're supporting people who are experiencing these challenges, but also who have the solutions. So today, it is our great pleasure to announce the launch of Connecting Climate Minds, a year-long endeavour to catalyse this connection and bring together the wealth of expertise already represented on this call, and to welcome in people from new spaces who can bring in their insights and their methods and their data sets and their knowledge, and come together for this moment of great challenge, but also opportunity for humanity. We want the climate change and mental health community to be strongly connected with shared understandings and visions across diverse disciplines, and create a thriving global ecosystem better equipped to respond to barriers and opportunities. It is my great pleasure to now pass on to outline this vision more thoroughly to Omnia Omrani.
Yes, so hello everyone, and we would love to share with you our vision for connecting climate minds. And first, we want to catalyze the connection across the climate change and the mental health field towards a more aligned vision and agenda, working inclusively and together with you. The second is that we want to identify the gaps and the opportunities both on the regional and the global level, whether either we have new evidence or the translation of the current knowledge could make the most difference for climate change and mental health. And we want to do this by bringing together the knowledge and the expertise that isn't always connected in creative ways. We want to listen to people who have experienced mental health challenges and climate vulnerabilities, both their needs and their solutions. But we also want to connect what we know with what can be done by identifying the barriers to policy and practice, ensuring that the research and the insights are translated to change and real implementation on the ground. And we aim to do that by creating for the first time an ambitious, inclusive, and actionable research agenda on climate change and mental health that is deeply grounded in the needs of people with lived experience of mental health challenges and climate vulnerabilities, and globally endorsed across research, policy, practice, and funding communities. We want to do that by, secondly, creating a connected, supported, and engaged community of practice on the regional level and the global level. And we want to do that with the right capacity building tools and resources to enact this agenda that will directly feed into an online global hub that will be a go-to space for the climate and the mental health research community and all those we need to work with. The outcome of our project is to first empower the regions, building 7 regional communities of practice that will hold their own regional dialogues that will inform the research agenda that has the regional perspectives, needs, and solutions embedded within. And we want to do that as well by listening to the frontline stories, collecting case studies, and also building capacity of the regional members. This will also be done with centering the needs and the experiences, as well as the voices of people with lived experience in the most vulnerable communities, by also creating 3 specific global thematic dialogues for youth, indigenous communities, and farming communities. We also want to synthesize the inputs and the insights coming from the regional and the people with the most vulnerable communities into the global research agenda, both looking into the research and the policy perspectives with open source toolkits, and finally, our global online hub. And to really present all the work of the year, we are going to do that in a global hybrid convening in Jamaica. The team that is leading this work, and really look forward to working with all of you. We have supporting the project oversight and providing research expertise is the Imperial College team, and bringing in the boundary breaking dialogue expertise is the Red Crescent Climate Center. The team and the organizations leading the Lived Experience Working Group is the Climate Mental Health Network, Force of Nature, and Susty Vibes. And finally, bringing in the convening and the capacity building expertise, supporting the regional communities. We have the St. Luke's Medical Center in the Philippines, the University of West Indies, and finally, Claretian University in Nigeria. Looking at the regions, we are going to build in the regional communities of practice within the 7 Sustainable Development Goals regions, as you can see in the slide. And we are going to have each region led by a regional community convener organization, supported by affiliated co-convening organizations in co-leadership with people with lived experience, as well as the youth ambassadors. Now, I'm very happy to give the floor to Jess to take you further into how you can work together with us.
Thank you so much, Omnia. Hi, everyone. So we would love you to join us in making this vision a reality. We know there's already a huge amount of expertise and impactful work happening at the intersection of climate change and mental health. We know there is so much knowledge and experience held by communities around the world. An actionable agenda depends on aligning with the great implementation work that's already happening between climate change and mental health, and we want to learn from this work. We also know that there are many types of expertise and fields that are needed to bring to this work, like examples of who this work is relevant to and how. You might be working in suicide prevention and need to consider how the risk of suicide is affected by rising temperatures and extreme heat. You might be an agriculture researcher and need to consider how the the mental health impacts of climate change and how climate mitigation and adaptation efforts are affecting farming communities. You might be working in climate change attribution, and this is a critical area of expertise that can be applied to help understand causality of climate change impacts to mental health. So it's only by coming together that we can enact this project's vision. Your involvement is crucial to the project's success, but we are also doing this project to be in service of the community in a way that informs future work and that creates a platform for existing work to be amplified and strengthened. Being involved in this project creates opportunities to help shape this research and action agenda in a way that is boundary breaking, that informs where climate change and mental health work goes now and into the future. This work brings opportunities to join regional communities, to learn from and connect with each other across disciplines and sectors, and to take part in capacity building and training, to inform the development of resources and access these resources through the global online hub, and to connect what we know with what can be done in policy and practice. So there are many practical ways that you can get involved in this work over the next year, to share your knowledge and experiences and help shape this agenda, and join a growing ecosystem in your region and globally. This is a really critical moment for the climate change and mental health field to come together and to rise to the challenge of a growing mental health burden by being more strongly connected, by having an aligned vision, by having shared understandings across diverse expertise and a global ecosystem that's equipped to meet lived experience needs and drive forward innovative and impactful work for now and into the future. Thank you so much, and I'll pass back to Jennifer.